So yeah, this video is gonna be about should you take ibuprofen or Advil or any anti-inflammatory when you have a cold or symptoms of the COVID-19. It says a lot of speculation, but there's very little data to say one way or another. That's bullshit because they know they already even did the data. So it say French Health Minister Oliver Vernerin warned COVID-19 patients to avoid taking anti-inflammatory drugs such as ibuprofen or cortisone. The statement ignited a discussion among experts and a slew of questions from the general public. If you have a fever, take prosentemenol. The prime minister said prosentemenol and Tylenol are both brand names for a drug called acetaminophen. But do such anti-inflammatory drugs actually exuberate or extravate COVID-19? Experts say there's not enough data. It's a lie. There is currently no scientific evidence establishing a link between ibuprofen and worsening of COVID-19. The European Medicine Agency, EMA, wrote in a statement on March 18. EMA is monitoring the situation closely and will review any information that becomes available on this issue in the context of the pandemic. The health minister warning was based on a recent letter published in the journal The Lancet that suggested such anti-inflammatory drugs boost the body's production of an enzyme that sits on the cell surface known as ACE2. The coronavirus hijacks these ACE2 receptors to enter human cells. The authors hypothesized that drugs that spur the body to produce more of this enzyme would allow the virus to infect more cells, which in turn would increase the risk of developing severe and fatal COVID-19. The only problem is no proof that this actually occurs. Angela Remison, a virologist, virus doctor at Columbia University in New York, wrote on Twitter, any of these hypotheses rely on several major assumptions that may not be true. More of that enzyme called ACE2 doesn't necessarily mean more infected cells, as viruses require other proteins in the human cells to replicate, she wrote. What's even more, cells are infected. That doesn't mean more copies of the virus will be created. And even if these cells produce more viral copies, that doesn't necessarily mean more severe disease. The severity of the disease can depend on other factors, such as the patient's genetics, environmental, and general health, the doctor wrote. Causer association. Should you toss out your Advil if you come down with COVID-19? I would not change recommendations based on this yet, says Dr. Amish Adua, an infectious disease expert at Johns Hopkins Center for Health security in Baltimore. I think we need to learn more about what the effects is, and if it is a true effect or just an association. For example, if it could be more people with high fevers and thus more severe disease are taking these medications more frequently because they have greater need for fever reducers, he said. In other words, they could have more severe disease in the first place. It is also known that an inflammatory drug can exacerbate problems with the kidney function, and in those pre-existing problems, Aduha told Live Science. And anti-inflammatory and acetaminophen medications work differently, though. Work and antis work through different mechanisms in the brain. Acetaminophen targets a brain region that regulates body temperature, whereas anti-inflammatory decreases the production of anti-inflammatory markers. The doctor said both effectively reduce fevers. However, in general, a fever is a protective response, he added. At such temperatures, the immune systems may work better and evade microbes may not be The immune system may work better and invade microbes, may not function as well, he added. So for such illness, letting a low fever around 101 degrees Fahrenheit, 38.3 degrees Celsius or so run its course may be the best for young and healthy people. For those underlying medical problems, fevers can be more dangerous, he said. Another reason some experts are concerned about the use of anti-inflammatories is that they may damage the immune system's response, according to The Guardian. But the logical anti-inflammatory agents reduce the inflammatory response, which could be beneficial in early stages of the infection, says Steve Morse, a professor in entomology at Columbia University. But inflammation is only good up to a point. Later on, inflammation becomes a serious problem in patients with pneumonia or severe diseases and exacerbates the damage, Morris told Life Science. In China and elsewhere, healthcare professions have tried treating patients with steroids to combat such damage caused by the immune response. It wasn't clear if it helped, and most people didn't think it did, Morris said. In any case, you wouldn't be a vigorous inflammatory response in you wouldn't want a vigorous inflammatory response in the later stages, so perhaps it's all in the timing, he added. Here in the U.S., the guidelines haven't changed. I haven't seen any firm data to indicate that there's a problem or to prove that there's not a problem. There is a problem or to prove there's not a problem. Dr. Anthony Fauci, the director of National Institute of Allergy and Infectious Diseases, said during a conference yesterday, March 18. Aspirin and other inflammatory drugs can cause children's risk of developing Rhine syndrome, a rare disease that can cause brain and liver damage. I think somebody made the leap from that to say that all anti-inflammatory drugs are non-steroidal are the same thing. Ferrucci said. Facucci said. Fahucci. Facucci. I don't know. In any case, you really just wait. In any case, you really want to just bring the temperature down. Tylenol every 6 hours is the way to go, the doctor said. With an impressive cutaway illustrations that show how things function and mind-blowing photographs of the world's most inspiring spectacles and how it worked. Oh no, I'm sorry. Okay, that was it. I'm reading something else. Yeah, okay. So, like I was saying, this is bullshit. They did they study. They know that ibuprofen and any anti-inflammatory medicine like ibuprofen and Advil, aspirin, things like that. That's gonna ramp up the disease. It's gonna make it stronger. It's gonna make it 10 times stronger. It goes from a simple cold to pneumonia. It goes through different stages, and they know that. And they want to keep talking about, well, we ain't did no study. We ain't got enough data. We ain't got. Look, that's some bullshit, people. Look, don't. If y'all out there, y'all sick and y'all feel like y'all got a little cold and y'all got a little aches and chills, do not take Advil. Do not take ibuprofen. Do not take aspirin. Do not take anything that's anti-inflammatory. Anti-inflammatory. I'm sorry. These words. So at the end of the day, if you don't want to die, don't take them drugs, them medicines. Find they said like Minnesota Tylenol. Tylenol do fine. You get you some Tylenol and take them and go to sleep. Don't take nothing else, no Advil, no ibuprofen, no aspirin. I don't know how much I can stress this because people is dying from this. And my mama just sent me a text from a nurse, and people is really dying. Like all the people that they found, the dead people that they found, excuse me, they bodies, they tested, they had Advil, ibuprofen, aspirin, anti-inflammatory drugs in their system. So if y'all get this video, please, I can't stress this no more. Tell your family members, pass this on. And they ain't got to look at this video, but just pass it on. Let them know. Like, if they sick, don't take no aspirins. Don't take nothing but Tylenol. That's all you need to take is Tylenol, because anything else is going to kill you. It's going to make you sicker. And they talking about, oh, you got to have, no. That's in the healthy people too. That's in anybody. Do not take them anti-inflammatory. Do not let these people fool you into thinking that, oh, well, I'm healthy. I could take this Advil. I could take this ibuprofen because I don't feel like it, or I don't have. Man, you better scrape some change up. You better get some cans and bottles and get to the can place to do something to get that change, to get that Tylenol. Everybody got Tylenol. You call your relatives. Somebody got Tylenol in a cabinet. So don't be lazy and be talking about, because at the end of the day, you fucked. You take that ibuprofen or that Advil. I'm telling you straight up, you're not going to survive, because the shit mutates it and it makes it 10 times, 20 times stronger. That's what they not telling people. That's how it's turning into the coronavirus. It's going from a little cold, and then when you take that Advil, that Tylenol, it turns into something monstrous. You see how they got the movies? They be cool for 1 minute, and then they do something like the Gremlins. See how it's a cute little fuzzy little thing, and then when you pour some water on it, It have babies, and then when the babies eat, they mutate into some hideous thing, green thing. That's what that disease is doing. It's going from something just real simple to something that's major, that's gonna kill you. So you could take it for what it is, and and take that drug. I mean, take them drugs and mutate that disease, or take that right medicine and knock it on out. That's what it is. And that's how everybody gonna combat this shit. They ain't telling everybody how they gonna combat it. They just telling you to stay away, stay 10 feet, stay 6 feet. Nah. Don't take that bullshit ass Advil and Ibuprofen. Because at the end of the day, that's gonna mutate it and make it stronger. That's what they not telling you. Yeah, true enough to stay in your house, to stay away, but you can't take them anti-inflammatory medicines. USA ain't gonna tell you that. These other countries gonna tell you. You see how the French Prime Minister had to tell you. The French Health Minister had to tell us and warn us. So get it together, people. Pass this around. Let your people know. And have a nice day. Hit that thumbs up, like, subscribe, comment. Have a nice day. And stay healthy.